What's next? At Biodesign Institute at Arizona State University, the scientists in our research centers ask this question every day. What's the next health challenge? The next human security challenge? The next sustainability challenge? Then, we design research projects that aim to find solutions for the challenges of tomorrow. For example, the Biodesign Institute's ability to be a leading force during the COVID-19 pandemic began with our work in developing tests that could identify the level of radiation exposure in individuals. In the early months of the pandemic, scientists needed to better understand the virus. Where was it spreading? How? And how quickly? The tests available at the time utilized a nasal swab, and Arizona didn't have enough of them.
One of the first things we did was figure out how to get those supplies into Arizona, because when we started talking to a number of hospitals in the area, it became apparent that probably in the state of Arizona at the time, there were no more than 1,000 swabs available anywhere. We had 100,000 people in the ASU community that needed to get tested. And there was a whole, community outside of ASU that might need testing. To do swabs at that scale was going to become very challenging. And so that's when we began, even in March, to start thinking about doing saliva testing.
The Biodesign Institute was able to quickly repurpose existing equipment and personnel to establish a clinically approved and certified COVID-19 testing lab within a mere 2 weeks. By May, Biodesign Institute researchers had developed the first publicly available saliva-based COVID-19 test in the nation. The non-invasive test was a game changer. It was more comfortable for participants and safer for clinical staff. It was accurate with fast results, attributes essential to curbing the spread of the virus.
Our motivation has always been saving lives. And so wherever we could find an opportunity to get testing done was an opportunity to prevent the spread of the virus. And to get that done, we needed to install automation so that we would be able to run a lot of tests. And we had to purchase supplies so that we could run those tests. And all of that was made possible by donation.
ASU partnered with the state health department to ensure enough tests were available in Arizona. And throughout the pandemic, Arizonans have been able to get free saliva-based tests because of the Biodesign Institute's work. But the Biodesign Institute's work doesn't stop here.
We also have a research approach, so this allows us to start doing research, figuring out better ways to prevent the disease, better ways to treat the disease, better ways to understand how it spreads, biologically and otherwise. And so a number of us are now developing research programs around this. When this crisis arose, everyone was ready to step in and do what they had to do to be successful at making a difference. That's what this whole institute, the Biodesign Institute, is designed to do, is to be able to translate discovery into impact. And if there was ever a biodesign moment, this was it.